Hi, everyone. Welcome to the podcast. Today's podcast may be my most timely podcast ever. We are going to discuss the impact of climate change on health. There doesn't seem to be anywhere you can go these days and not be affected by climate change. We, of course, see what's going on in Los Angeles, the fires, the mudslides, the pollution. You know, in the southeastern part of the United States, there's been these devastating floods from hurricanes. And if people are paying attention, the blistering heat in parts of Western Europe that were reaching all-time record levels. The question I wanted to talk about today is, what is the impact on our health? My guest today, Dr. Catharina Giudice, is a fellow at the Center for Climate, Health, and Global Environment at Harvard's T.H. Chan School of Public Health. She's also an emergency room physician, but is now focusing her attention with her colleagues at the center how climate change is impacting our health. So I'm really pleased to welcome Dr. Catharina Giudice to the podcast.
Thank you so much for having me, Dean. It's a pleasure to be here. And I agree with you. This is a very timely conversation. So I'm excited to be here and I'm happy to answer any questions.
Great. Okay. So the first thing I want to ask you, if you can do this, is a little tricky, is, there are those that are the climate change deniers. What would be your elevator pitch if you ran into somebody, whether it was at a wedding, a party, or whatever? Oh, this is nonsense, whatever. What's your response to them to maybe counter their beliefs, if that's possible?
That's a great place to start. Usually what I like to say is that climate has changed throughout the entire history of our planet. We have incredible data from a lot of different sources that show this. It has fluctuated throughout millennia. What's very different about what's happening nowadays, Dean, is that it's not following what predictive patterns we would expect from all of these ancient data sources that we have. The only way that we can explain the degree of carbon monoxide in the atmosphere, and the only way that we can explain how this accumulation of carbon monoxide is increasing our average temperatures beyond what we have seen and beyond what's predicted based on all of these historical data sources is through attribution of the carbon monoxide to our burning of fossil fuels. So yes, temperature has changed over the years. Yes, climate has changed over the years, but we're not following historic patterns anymore, unfortunately. And again, the only way that we can really put everything together based on our best scientific resources is attributing carbon monoxide and the current temperature changes to burning fossil fuels.
Yeah, I think that's a really good explanation because it's something very specific. And, people don't always like to hear this. I mean, I feel like I'm doing my small part by driving an electric vehicle, but it's a concern. And, and as we said, we're seeing these unusual things, in our lifetimes, that when I was younger, don't recall anything like this. Let me ask you specifically about yourself too. You were trained and are an emergency room physician. Is that correct?
That's correct.
What made you get involved with the Chan School of Public Health, really essentially getting into, changing your role? It's a big decision for a doctor to leave sometimes clinical care for something less clinical.
That's right. Maybe I'll take you back a few years.
Okay.
I've always been very concerned about climate change. I think my generation was already appreciating a lot of the changes to our environment. And I love the outdoors. I always, appreciated having a healthy planet that I could enjoy. And in undergraduate, I became even more interested in the topic because I developed another appreciation for the policy side of things, how difficult it was to negotiate from a multilateral standpoint with many countries, with many interests. How do we actually come together as a as a global society to address some of these very complicated issues. Career took a few turns. I ended up going into medicine, and I was fortunate enough to be at a medical school where the conversation of climate change was really pioneering the discussion in the medical field. I started to see how climate change was not just changing our environment, but impacting health in very substantial ways, and started to actually see it as one of the biggest threats to human health in my lifetime. From there, I went to an emergency medicine residency in Southern California, where I was seeing some of the worst heat waves in Southern California history. At the time, some of the worst wildfires. It's not true anymore, unfortunately, with the current fires going on in LA. But was seeing how those environmental hazards were impacting the patients that I was taking care of, and felt like I needed to do more. If this was such an important issue for me, I needed to be able to take a more proactive approach. I did a lot of work in sustainability while I was in residency, but seeing the impacts of climate change on the patients I was taking care of and seeing how it was impacting healthcare delivery, I became particularly curious what we should be doing proactively as a healthcare system to really address and prepare to be able to continue to deliver high quality care to patients in a world that is going to be seeing more severe, more extreme weather events throughout the entire world in very different, unexpected ways.
Yeah. That helps us segue to about the LA fires, which I think is going to bring out a lot of important points. I read, it was in one of the papers, that the article basically said that the wildfires in California actually aren't wild anymore. They're now burning in urban areas, creating a toxic soup of smoke, ash, noxious substances that are not even found in true wildfires. Buildings were burning down that had chemicals and gases from metals and plastics. So even when you eventually control these fires, how can you get residents to come back to this area where there's been so much, air pollution? What this reminds me of, Dr. Giudice, is that, one of the things that really brings to mind was, I'm in New York and I practice in New York City, was after 9/11. And, again, we saw all the images of the towers that were burnt to the ground and all the soot and everything in the air. And unfortunately, a lot of government officials were saying, oh, it's okay to come back. Everything is safe now. And people did. And there were people, first responders and volunteers who worked on the pile, who for the next 20 years were sick and involved in lawsuits that are still going on. People know from Jon Stewart, who's been doing a lot of great work trying to get these people, money for their medical care. And, and sometimes when you look on what's going on in LA, it looks like Chernobyl or Hiroshima, one or the other. So what do you say to, or what would you say to people that ask you, what should residents of LA do? Is it safe for, all adults to go back, the elderly, children? I mean, if it was your family, would you pick another place to live? I mean, honestly. That's the point of, listeners really, it's really tough decisions, but what's your thoughts?
Yeah, it's another great question. And I don't know that I have great answers for this. I certainly have a few thoughts that
you just have your opinion.
I think that one of the things that I think is important to emphasize is that we're still trying to learn about the long-term impacts of a lot of these natural disasters. I think that we know a lot more about what happens acutely after a hurricane. We know a lot about what happens acutely after a wildfire that interfaces with urban populations, like you were mentioning. But we don't know. I think we need to learn more about what happens long term. How is the impact to the healthcare system going to affect people's access to healthcare? How is this very, very profound exposure to air pollution going to affect health from a chronic standpoint years after the exposure? I think we're learning more about how these climate hazards impact health in a long-term time frame. I don't have answers whether it's safe to go back or not. I think the question that I have as a climate researcher, is thinking about, do we rebuild in these communities that we know are at risk for having a lot of really detrimental impacts over the course of the years that are expected to get more severe and worse. That's the decision that we have to make as a society. Is it worth to rebuild in these communities? Is it worth to go back? Obviously, it's going to take generations to recover, or a lifetime to recover from this. Just like you were mentioning, it takes a lifetime to recover from these devastating disasters. That some are man-made, some of them are natural.
Yeah, it's a combination. Well, you know what's interesting too? They also mentioned that the Getty Museum, which I've seen from the outside, I've never been in there, is still standing quite strong. Apparently, they had the foresight, the way it was built, to withstand, obviously, this kind of disaster. So I think, honestly, going forward, whatever they do in LA and other places, again, I know I'm also on Long Island and in the South Shore, where, Hurricane Sandy was very devastating many years ago. Most of the houses now are being built up on like stilts. And they're talking about that even in Los Angeles, and I see in Florida all the time. That makes sense. We have it might be more costly, but hopefully maybe insurers would appreciate if houses and structures were built to withstand the worst and not just, wing it. And unfortunately, you could have like a Getty Museum fortified, but if all your neighbors around you are devastated, what good is it? So it's really got to be, I would imagine a center like yours influencing, the urban planning, for future cities, because that may change as well, too, the whole work hybrid thing, et cetera. Let me ask you this, too. We can get to a little bit of the science. It was, again, a diagram I saw that showed, that the burning vegetation, for example, sends off different particle sizes, something called PM10, which is the larger particles that go into the upper respiratory tract. So for listeners, typically like in your throat and your nose. And then the smallest particles called the PM 2.5 that get deeper into your lung. How dangerous are these different particles? And how, I don't know if you know this answer, and how long can they sometimes last in a person's lungs? Because, again, the biggest concern is almost like asbestos and what happened at 9/11. People got exposed to these ultrafine particles, which unfortunately probably gave rise to certain cancers.
Yeah, so you mentioned PM10 and PM 2.5, just so the listeners are aware. So usually the designation of 10 and 2.5 has to do with the size of the particles.
Right.
So like you mentioned, the PM 2.5 are the smaller particles that can get to much deeper areas of the lung. And intuitively, it makes sense that those particles that are able to get much deeper are the ones that might cause more substantial health impacts. There's a lot of research out there looking at a variety of health impacts attributed to PM 2.5. I think when we think of air pollution, we think of worsening respiratory conditions, so asthma exacerbations, COPD exacerbations. But what's really interesting that's coming out of a lot of these very robust epidemiologic research efforts is that we're actually seeing other chronic diseases that are being exacerbated by exposure of PM 2.5 specifically. So things like cardiovascular disease,
right. People would think that,
increasing rates of stroke, of myocardial infarction, a variety of cardiovascular conditions that are being impacted by this particle that goes beyond just the respiratory system.
Yeah, that's a great point. And just for our listeners to know also, because you were further explaining, and again, they show this in the diagram that I'm looking at, a PM10 micron particle is the size of a hair, and a PM 2.5 is beyond smaller than a hair. So you can imagine these superfine particles that we're breathing in. You can't even see them. You might be saying, you might be in an area and say, oh, it seems fine, I'm near the ocean, but you're breathing this in. And, again, it's causing some kind of inflammation in the body. And you're correct. It's so important too, like where they find in these areas that unfortunately cardiovascular things, probably like heart attacks and strokes, and as well as obviously the long-term effects concern about dementia, right? So again, big issues. What about for the children? I was also just seeing an article that said that the LA air is really sickening many children. And it was interesting. I didn't know this, and I take care of children, but children's lungs, well, this makes sense, are still developing, and it makes them more vulnerable to pollutants. Sometimes, it's funny, you'd think they'd be more resilient maybe in some ways because kids just in general are, but I guess not for this. It's just too heavy a burden for them. Is that something that you would sometimes see in the emergency room? Did you see a higher percentage of children coming in than maybe adults?
Definitely from my experience, especially when I was working in Southern California, I do recall seeing higher rates of pediatric patients, especially because there's such high rates of asthma in our pediatric populations. A lot of patients coming in with the exacerbation of underlying conditions. The timing of your question is quite funny because I was just talking to a pediatric colleague that currently works in LA and was sharing that in addition to a lot of respiratory cases that were coming in during the wildfires, what I found particularly interesting was increased rate of patients that were coming in that have a lot of complex medical conditions that had to be evacuated from their homes without their medications. And now we're coming in to the emergency department either with exacerbation of their condition or with just loss of all of their medical resources and needed admission so that that care could be re-coordinated for them. So yes, I think the pediatric population we tend to think of as being particularly vulnerable to a lot of the climate hazards that we think about, not just wildfires, but also extreme heat, also hurricanes, floods, and for a variety of physiologic reasons. I was going to mention one more thing about exposure. Pardon my lapse of memory. Another, I think, important thing to mention is that another population that is at particularly high risk are pregnant women. And there's a lot of research out there that's showing that there's a lot of detrimental impacts to pregnancies, including preterm births and pregnancy outcomes. So not just the pediatric population, but even in utero, I think there's concern of how that smoke exposure might impact both the baby and the mom.
That's a great point. Super great point. One other thing too, just to move a little bit aside from just the physical aspects, what about also the mental health issues? And I think that never gets enough attention. We don't really appreciate when, God, a family loses their home and they're homeless and they got to find any place where to live. I remember even in my own practice, there were sometimes patients that had a fire in their home, their house burned to the ground. And as somebody who I took care of regularly, who was usually a very optimistic up person, and I could see the depression setting in, which makes sense. Is that given enough attention to also? Probably not, because again, you're dealing with, especially in an emergency room, you're dealing with the acute physical things. But do these people ever get referred to, or do you notice that populations really need more essentially social work, psychiatric counseling, things like that?
Mental health is definitely an incredibly important conversation that's been gaining quite a bit of momentum in the climate discussion. Like you mentioned, Dean, there's obviously the acute impact of to one's mental health, people that already have underlying anxiety, depression, possibly post-traumatic stress disorder, that are now seeing their homes having to be evacuated, sometimes losing their homes, sometimes seeing those hazards happen again and again in their communities, not just a one-time life impact, but sometimes they're seeing it over and over again, some people being displaced permanently. I can't even imagine how extensive some of those mental health traumas can go. The other thing that I tend to think a lot about as well, maybe not necessarily something that I see as an emergency provider, but the underlying climate anxiety that a lot of people have, maybe that haven't necessarily witnessed extreme weather events in their communities, but are seeing these global events happen and are feeling like they have so little agency in this discussion and so little agency on what we can do about it. And I think that underlying impact is also quite broad and substantial.
It's interesting too on TV, which is very sad. It's really hard to watch sometimes for a very long period of time, but occasionally the news crew, because again, so many areas are blocked off, people can't even get back to see what's left of their homes. But occasionally the news crew gets, I guess, permission and brings somebody back. And then you see someone standing there looking at their home that's been destroyed. And then sometimes if they're even allowed to go close enough up and they find a remnant of like a picture frame or something there, I mean, you just see them crying and, your heart just goes out to them. And so, yeah, as we were talking about, I mean, this is just a combined physical and mental calamity. And I think that's why it's so important. Honestly, I was going to get into what the work that you do at the center. And I actually was leading up to all this. I was going to start out with it, but I'm glad we kind of circled around to this, that what do you guys do? It's going to be a two-part question. What do you guys do to help form policy and also possibly to guide? I mean, if a governor of a state or mayor called you up and said, look, we don't know what to do. I mean, I know we're doing the most acute stuff, but what is it we can do to make people's lives just a little bit better?
Dean, I feel fortunate that I am in an institution where a lot of people care about this issue, and there's so many people with a variety of talents and interests. So I feel fortunate to be in an environment that is very multidisciplinary, people that are tackling this issue in so many different creative ways. Like you mentioned, it's so important for us in academia and healthcare to be able to translate what we're seeing on a daily basis and translate our research into actual practical recommendations for policymakers. A lot of my colleagues have found really awesome ways to be able to translate their experience into local state policy, into national federal policy, but also at an international level. They found ways to collaborate with their expertise in legal cases. So there is incredible work that's being done in translating some of our daily experiences and research into
Could you give me an example? I mean, is there anything that comes to mind? No. Okay, it's a little tentative. Okay.
Yeah, no, I can give you an example. I don't know how much detail I'm able to share, but there have been cases of communities suing the lack of a healthy environment and using legal platforms to be able to advocate for stronger policies to protect their environment and decrease environmental hazards to protect their health. So colleagues that have been able to contribute their expertise in those legal platforms to support those cases that have been quite successful. So that would be just one.
Okay, let me ask you this, because I hate the lawyer stuff, but it's part of it. But let me ask you this too. Let's say, I forgot the name of the mayor in Los Angeles. She's under a lot of heat right now. But let's say they come to your center 5 years ago, say, we know we got problems where, so it's really like a medical practice or work in the emergency room. You're getting attacked. You just don't know from which direction yet. And I know, one of the things of being a doctor, and I'm sure you feel the same way, is that I have learned the best that I can to prepare for a lot of contingencies. It's just the way I roll, the way I do my life, because life teaches you lessons early on that if you don't prepare, things can happen. And if you do have a little bit of preparation, you can sometimes deal with whatever gets thrown at you. So just out of curiosity, I mean, if they had approached the Chan Center and maybe somebody who was working in that area and they say, look, we know we have a lot of natural disaster type of problems looming, do we make sure that the water supply, unfortunately, we heard stories that the pumps didn't shoot the water enough, through the fire hydrants. Is the brush, could they have done something ahead of that? We have so many smart people, people who are, geologists, chemists, the whole range of things. Does the Chance Center or any place have that kind of capability to go in and say, look, these are the things you should be doing because, again, we don't know, it could be the one in 100-year flood or wildfire, but at least have a whole plan. And also, I know I'm sorry I'm going on, but it's like also, and what's the plan for residents? Like something like this happens. How do the same way they show you on a plane, here are the emergency room exits, make sure you know where they are and where the oxygen is when it comes down. Like, because I think most people would panic. It's not like they have a whole plan in place. Do you advocate for stuff like that? I mean, or is it just too far fetched?
You're speaking my language.
Okay.
This is a big part of the interest of my interest, of the interest of the colleagues that I work with, is focusing a little bit more on adaptation. Adaptation as a synonym of building resilience. There's when maybe I'll give you a little bit of the framework that I have in my mind.
Sure.
When I think of what we can do about climate change as a medical field, for example, I think that there's a lot of things that we can do to mitigate climate change, a lot of things that we can do from a sustainability standpoint to decrease greenhouse gas emissions of healthcare delivery. And if we all do our part, the idea is that we're going to decrease carbon emissions and curb how much warming we're going to see in the future, which is the most important thing. At the end of the day, if we're able to, every degree that we're able to mitigate is going to make our lives easier in the future. The other side of it, though, is that we're already seeing a lot of the climate impacts to health. We're already seeing worsening heat waves. We're already seeing more severe hurricanes going to higher latitudes, worsening precipitation, worsening droughts, human migration, you name it. And we anticipate that these things are going to get worse based on current projections. So the other side of the equation is, what can we do to prepare what's already happening? How can we be proactive about our approach and not just let the hazards get worse over time and see really big impacts to our communities without having had any substantial preparation for these worsening impacts? So that's the adaptation, building resilience side of things. And that's something that I am very passionate about. I know a lot of my colleagues are working towards. We're trying to understand better what the impacts to health is at a community, at an individual level, but also what the impacts are at a healthcare facility and at a health system level. And what can we do about it? And it's an incredibly complex conversation, and I think I could spend hours talking to you about this. But even simple things as, what should we be telling our patients? Who should we be educating? Who are the patients that are at greatest risk for all of these different climate hazards? Who should we be targeting? When should we be having these conversations with our patients? Should it just happen at the beginning of summer before heat hits, or should we be doing it every single time when we're going to be expecting a heat wave in our communities? What should we be telling our patients? How they should be preparing at an individual level, but also preparing their families. And so these are definitely the adaptation side of things. How should we be changing our practice and better preparing for these hazards is definitely, I think, a very, very important part of this conversation.
It's funny you say that. I had a physician on the podcast, I think in the last year, who's actually a nephrologist. We were mainly talking about kidney stones. And I don't know, he had this one, it was really funny because I was looking at his website before, we were going in depth about kidney stones and kidney function, which was very interesting. But he was very interested in climate change, which kind of caught my eye because, and he said, he actually did this in an interview that he did that we talked about it, where he tries to set aside at least 5 minutes out of his patient visits to talk about climate change with them. And part of me kind of smirked, like, what are you going to get done in 5 minutes? And what are you going to do? But I realized, it has to start from a grassroots level where, everybody, the same way doctors, I know it's possibly controversial about guns in the home and things like that too, where we just know unfortunately, bad things happen. And maybe all of us can do a little bit more, whether it's, moving away from fossil fuels, doing electric. I follow a lot. I'm very interested in Bitcoin. And, you have to really go down a very deep rabbit hole because people always say, well, how much energy it uses. But actually, they recycle the energy. It's very interesting. And one of the big things that's happening in that community that they're working with a lot of different energy sources because it requires that. And AI is going to be a big thing, too. All these use 10 times more than, for example, Bitcoin. And I think people are going to have to open up again about nuclear. I know that it's getting a revival. There's obviously, we've seen the disasters, but there actually been less than compared to some other kind of disasters like oil spills. And, it's funny, too. I was just about to mention before, too. One of the things that worries me the most about climate change, believe it or not, is when I hear the ocean temperature is rising because just doing a little bit of my math, 80% of the planet is water. So if that temperature is going up, that means only not good things are going to happen, whether it's to the ocean life down there. And then, of course, it affects the atmosphere. And
the acidification of the oceans, right? Increasing temperatures, but also the oceans retain a lot of carbon dioxide. And that's why we haven't been seeing the global temperatures increase that much, is because the oceans have acted as a buffer, absorbing all of the CO2, and the acidification is already having incredible consequences on fisheries and food access to a lot of coastal communities. And like you're mentioning, 8% is oceans, or I'm not quite sure what the percentage is, but a huge percentage of the planet is oceans, but also a huge percentage of the global population is coastal as well. So a lot of communities.
That's a great point. Right. People go there, right. That's always kind of been the way a little bit because it's just access to imports and yeah.
That's right.
Let me ask you this. Today is actually, when we're recording this, is the inauguration of a new president. We're going to keep it. I'm sorry, we're going to take a break for one moment. Sorry, we're back. I wanted to ask Dr. Giudice this really important thing. Today is the inauguration of a new president, and we're going to keep politics aside, whether you're Republican or Democrat. But let's say President Trump calls up your office, the center, and says, okay, we're going to get some executive action done here. What would you like to see done in California in the next 6 months? What would be, if you had free reign, any specific ideas, to get this community back, to make it safe for the residents to go back? Throwing this on your plate. We only ask big, tough questions here at the end.
I love it. Okay. National policy on climate is so incredibly complex, but if I had it my way,
we'll give you the.
Dean, I think at the end of the day, I really do want to emphasize, I think mitigation is the most important thing. I think we can't lose sight of that. Okay. If we don't decrease burning of fossil fuels, we're going to there's different climate projections that are based on incredible science that are telling us that if we keep doing things the way that we're doing, we're going to see, upwards of 4 degrees Celsius temperature increase compared to pre-industrial levels, which I think the consequences to health at that point are just going to be unimaginable. So I think mitigation at a national and international level should be the number one priority. I
meant to ask you, are we the biggest culprits, or do we have to worry about with China or other places? I mean,
we're certainly top 3.
Top 3. Okay. So we can make an impact because, we can't control, obviously, what goes on in China or India, those places. Mm-hmm.
Yeah. And as a healthcare provider, like I was mentioning to you earlier, I really worry that we're already seeing a lot of the health impacts that are just going to get worse as time goes on. And I wish that we would invest more resources into being proactive about protecting our communities and protecting our healthcare system. So that would be my second ask.
That's important. Yeah, I don't think people really realize the appreciation of clean air. Really, it's interesting. I've read articles over the years where in China, there's like sort of an upswell from the moms. They're seeing their children get sick, and the pollution is so bad there. And what's really interesting? This was pre-COVID, when I used to see a lot of in New York City, Japanese. I don't know if they're Japanese Americans or Japanese tourists were always wearing masks. And I was thinking to myself, oh gosh, they must be like worried about catching an infection from somebody. Isn't that strange? This was before COVID. But I think they were just really attuned to the pollution and realizing, I guess, for whatever reason, the impact it has on your health. So, and wearing masks are horrible, as we all know. I mean, that's why I didn't go to surgery. I didn't want to be in a mask all day long. But well, anyway, Dr. Catharina Giudice, any last points that you want to make? I want to give you the floor before we conclude this interesting podcast.
Yeah, I always like to share that this is a very complex issue. I think it impacts so many facets of your life. It certainly impacts a lot of facets of health and healthcare delivery. And like I was mentioning earlier, I think sometimes an issue that is this complex and this global might feel very difficult to address at an individual level. But I do believe that individual action matters substantially. And one person doing the right thing can inspire others, can inspire entire communities, entire groups of people and states and nations. So I don't want to underestimate the power of individual action. I think as healthcare providers, since this is our main audience today, I think that there's so much that we can do, not just from an individual standpoint of driving electrical vehicles, voting on policies that are climate friendly, choosing what you buy at a grocery store, eating less meat. All of those individual actions do matter, but also we're the ones that are interfacing with the communities. We're the ones that are interfacing with patients. We know our patients so well. We know their risk factors. We know what's going to speak to them. And I think there's so much power in our ability to have that discussion with patients and share how climate change might be impacting their health at a local level. And I think we're already seeing a lot of those impacts on our daily practice. So sharing what you're seeing in your practice with your patient. And there are a lot of awesome resources out there that healthcare providers can get access to of how to educate their patients on action-oriented advice of what they can do based on whatever climate hazards you're experiencing in your local communities. And maybe we can share some resources of our center that have been developed of how providers can have this action-oriented conversation with patients. Maybe we can put a link in the description.
Absolutely. That's a great idea.
That's such a powerful thing that we can do as providers. So again, I think my last message would be that individual action matters, especially as healthcare providers who interface with patients in the front lines. I think everything that we can do is going to inspire other people to do the same. And we really do need communities to get together and do everything they can.
No, that's great advice. Dr. Catharina Giudice, I want to thank you for taking the time to come on the podcast. And for our listeners, I think the future for all of us and the future for our children, it's so critical that we pay attention to this issue and hopefully have the courage to make the changes that we all need to do, even if it means sacrificing in some ways for the betterment of our planet. So anyway, thank you all for listening. If you enjoyed this podcast, please subscribe and leave any comments that we would like to hear from you. Until next time.